Your child is struggling in school, maybe not completing their tasks, they're constantly losing focus, or they can't seem to sit still. A professional, maybe your child's doctor or even teacher, suggests that ADHD might be the reason. What happens next? In this interview, I'm back with Dr. Karen Jensen, a naturopathic doctor, educator, and author of the book, Mental Health Crisis in Children and Teens, to answer this question and more about ADHD. Karen, attention issues, ADD, ADHD, these are a really hot topic right now. Can we start with helping us understand, the audience understand, the situation in Canada and how diagnosis is typically done in children and teens?
Sure, we'll try. Let's start with just looking at some of the newer statistics, which are pretty disconcerting, actually. ADHD is 80%, has a 80% hereditary component, higher than most mental health disorders. And parents who have ADHD, their children are about 50% more apt to have ADHD. And at this point in North America, according to the Center for Disease Control, 1 in 9 children have ADHD.
Okay.
And this is a growing concern. And I would assume that if they say 1 in 9, those are ones that have been, I would say, assessed, perhaps not received a full diagnosis.
Right. So how is a full diagnosis
Well,
done?
in Canada, it's usually done through a general health practitioner who gives the child a typical list of questions called the DSM-5. And usually these practitioners are not trained specifically in ADHD. And then the school may also be asked to fill out the questionnaire because it has to be done in 2 separate environments. Okay? And then kids in Canada are also asked to have a hearing and eyesight test to rule out any physical symptoms. And these symptoms from the questionnaire have to have been present since under the age of 12 and under, and who have been present for at least 6 months.
Okay. So outside of the eye and hearing exams, which are more objective, obviously, it sounds like those questionnaires are fairly subjective.
They're incredibly subjective. What they do is they break down ADHD into subtypes. You've got your inattentive type, and then you've got your hyperactive, and impulsivity is included in that subtype, so hyperactive impulsive type. And then you've got a combination of the two. Now, kids under 17 have to have said yes to 6 in each of the categories, and children over 17, 5
Okay.
in each of the categories.
So it's very different depending on the age.
Age, day,
Right.
circumstance.
So is there any advantage to having these initial assessments done?
I think there is, but I think that parents and the person and caregivers need to be aware that it's not a diagnosis. A diagnosis is complex and should be carried out by a child psychologist or psychiatrist. But an assessment can help people realize that, yes, this child may have some of the symptoms of ADHD, which simply means that they should have more attention and help in areas that they may be struggling. Like, say, time management, which is a really big one for people with ADHD. And also, if parents suspect that their child may have ADHD and want to have an assessment done, then they can have it done, but just give it some time.
Okay.
You know, learn what you can, learn everything you can about what these kids need, what the specific struggles might be.
And a real diagnosis can take years in BC. I mean, it can take a long time to get into one of those professionals.
It can take years.
To receive that. So it's really important, I think, for adults to help educate themselves, right? But there are a lot of sources out there. So how do they navigate that?
There's a lot of sources, and there's a lot of information and misinformation. Some might think that medication is the answer, and that'll take care of all the symptoms. Others might think, oh, it'll all go away, once I'm out of school or once I'm out of university. There's just so much, and the information just kind of goes on and on and on. Like, for instance, a chemical is often attributed to a chemical imbalance. And dopamine has been suggested. Well, we don't really have the tools to measure these things, so it's really supposition. But when they look at dopamine, they think, well, is the brain not producing enough dopamine? Is the brain unable to use the amount of dopamine it produces? Or does this person need more than normal?
And that's just one factor.
And that's just one factor.
Yeah.
And they don't know.
So I want to move to a really interesting phenomenon, which is birth month. And it is shown, one study showed in particular that children born later in the year were 77% more likely to be diagnosed with ADHD and getting that label. So I'd love to know more about this and what your thoughts are on that.
Yeah, the birth month study is an interesting phenomenon. It came out of UBC in, I think, 2012, and initially studied kids that were given psychostimulants. And they found that kids born in January, now we're not talking calendar year, we're talking, or school year, we're talking calendar year. So kids born in January of the same calendar year versus kids born, say, September, October, November of the same calendar year, kids in January are almost a year older than kids born, say, in December. And kids born in the latter part of the year, they found boys that were born between September and December were 41% more likely to receive a psychostimulant medication, and girls 77% more likely to receive a stimulant med. And really, now what they're referring to this as is the medicalization of immaturity. This age impact has a profound effect on how they choose or how they assess, ADHD in young people. Whereas really, if you look at a year in brain development in a young child is huge as far as maturity, learning how to learn, learning how to respond. And when you start thinking that these kids need medication, when really it's simply an age-related situation. And these kids are given not only a label of a mental health disorder, but of a specific learning disorder, and labels tend to stick no matter what.
They do. And what would you say your experience was, especially with teaching, with labels and how they stick and how they affect a child's, longevity and productivity and mental health?
Yeah. When I was teaching these so-called behavior kids, which really most of them had learning disabilities, in the 70s, one of my roles was to reintegrate these teens back into the main school. So I would go into the main school and I would work with both the teachers and the students that were being reintegrated. My biggest challenge was changing the attitude of the teachers. If that teacher had had that child, taught that child in a previous year, and already had them labeled in their mind as a problem child, no matter how much that child had changed, no matter how much more better their attention was, their behavior was, they didn't accept it. In some cases, it was impossible to change that attitude.
So it sounds like overdiagnosis is more of an issue than underdiagnosis, or even that assumption of a diagnosis.
Assumption of a diagnosis is a problem. And it's interesting that overdiagnosis primarily comes from those that have the most mild forms of ADHD. And I think many of these kids, all they really need is parents and teachers to be aware that they're having struggles in various areas, and that different ways of different methods, different environments, quieter environments to help these kids, whatever's required to help them get through and to succeed. You know, it's a matter of awareness and educating and having the empathy rather than first reaching for some kind of medication that may end up causing more risks than benefits, which we'll talk about.
Yeah, so with that overdiagnosis comes that increase in
And
prescribing
psychostimulants,
stimulants.
exactly.
Yep. And I see that a lot with adults. I do more patient work with adults than children, but I have a lot coming in asking for the assessment of ADHD and ADD because of that desire to have a prescription for a stimulant. How would you say adults struggle with ADHD, or how is that different in the adult population?
I guess I could share before we get into adults and that increase. I think it would help people understand maybe some of the struggles that adults have. I was diagnosed kind of by mistake when I was in my late 50s. So I had lived with ADHD my entire life. I kind of suspected that I might have it after the work of Dr. Doris Rapp and then through my clinic and treating other people. But that was okay. And then a friend of mine who was a social worker, she'd just attended a conference and she'd listened to a doctor that she thought could help me. She must have seen something in me in order to send me to this particular physician. Because at my first visit, I thought I was just going for a pill for insomnia. That's all I wanted. And he told me he was doing a series of research on adults with ADHD. So after several visits and multiple questionnaires, he told me I had severe ADHD. I thought, well, fair enough. You know, I graduated from medical school. I've had a successful clinical practice for 30 years. I've written several books. Okay. What now?
Right.
But I think it helped me in some ways, having that assessment or series of, to help me realize the things I had to adapt to and things I struggled with. I always thought my brain worked like everybody else's around me. Like, why was I struggling and they weren't, right? I could never figure that out.
Okay.
And I got in trouble a lot when I was young. Like back in the 50s, we still had the strap. And so if a teacher was saying something, maybe it didn't make sense to me, so I would interrupt, you know, like, wait, you know, what do you mean, you know? And so I was often taken in the back room, asked to hold out my hands, and given the strap because they thought I spoke out at inappropriate times. And maybe I did. And maybe I still do. But at least I don't get the strap anymore because it really hurt. And there's a lot of things that, you know, I still find, like throughout my day.
So the diagnosis helped you with that clarity, and how has it helped you with some of the challenges?
Well, I've had to learn to adapt. There's a lot of things, like one of the things with the impulsivity side of it comes when I feel that someone is taking too long to make their point. It's like, come on, land the plane. You know, so I might interrupt or finish their sentences for them. And if they don't know me, they might think I'm being disrespectful or rude, but I'm not. It's just the way my brain works.
The way it works.
So I think I've learned to say, I'm sorry. I didn't mean to interrupt. And I think one of the hardest things with having ADHD was the focus. You know, especially if I wasn't interested in something, to stay focused long enough to complete a project in a timely manner that was, say, required in school. Now I know what to do. You know, if I get bogged down, I'll get up and move around and I'll move on to something else. Well, kids can't do that in school at this point, but I really believe if caregivers and teachers were made more aware, they would allow more for that. Like I have to watch myself throughout my day because it's quite humorous, right? Like the distraction part. Like I can be cleaning up in the kitchen and then I see something that belongs upstairs. So I go to take it upstairs. I go, oh, the laundry hasn't been folded. So then I start folding the laundry, forgetting all about the going upstairs, never mind what's in the kitchen, you know? So it's, I'll eventually get back to it, but I think people with ADHD just have a different way of getting to the end point, so as to speak. I was reading a really interesting article that related to my ADHD brain. And this author called it the intersection model. And it was basically about how whatever thought or the strongest thought that gets to the intersection first, to get to the stoplight, is the focus at the time. Everything else is not that important. And in an area of the brain called the prefrontal cortex, that is the part of the brain that actually regulates and helps with learning and attention and self-regulation. People with ADHD, their prefrontal cortex is less regulated. So they don't have the stop signs or the stop lights. So whichever car or thought gets there first is the focus. So you could have somebody, a teacher, and the smartest kid in the class, they could be ultra motivated, very intelligent, and they're sitting there and the teacher's saying, well, this species of dog is XYZ. Well, someone with an ADHD brain could say, oh, I wonder what my dog is doing right now.
Right.
And then they'll just run off on a tangent, and if you're in school, they'll completely forget what the topic was about. So, you know, and they get in trouble for that, right?
I like that analogy, though, the intersection. It's a good way of looking at it.
It works for me.
So ADHD brains, adults with ADHD and children with ADHD, their brains are different. They think differently.
They think differently. I think most people have linear thinking, you know, A to B. Gosh, that'd be nice. And people with ADHD have more nonlinear thinking. They get to the solution and to the goal, but through different methods that are less understood. Maybe it's more creative. Maybe, I don't know. It just doesn't take the same route. You know, it's nonlinear. It's kind of all over the place. And this helped me. It helped me understand, I think, why even in the middle of a conversation, somebody can say something and a word, and all of a sudden the topic is off on a completely different because of a word that I may have grabbed onto, and then it's like, oh.
You run with that.
And I'm almost saying, oh, sorry, sidebar, you know? Yeah, and so it's just a matter of understanding that, and I think just trying to bring it back as much as possible for the person with ADHD to what the subject matter was. If someone without ADHD could watch myself and another friend have a conversation. It's like a ping pong match. You'd be going, where's the topic going to end now? Because it changes so dramatically. And I think it would be very curious to observe and quite humorous,
Yes.
probably.
May I ask you a personal question?
Sure.
Did you ever take medication or try medication for your ADHD?
I did. I tried one day, and I'll never forget that day. It was difficult. I felt like my brain was having to slog through quicksand. I definitely had linear thinking. I had monofocus. There's not all this stuff going on over here, which I always found so much more interesting. So I understand why, for some people, that it can help them if they're having a hard time succeeding in school or university or at work. But for me, it just wasn't the case.
So without medication, did you learn to adapt over the years?
I think so.
Yeah.
Some people might disagree. But I think so. I mean, I'm always having these inner conversations. Oh no, I shouldn't blurt out with that right now, or I shouldn't say that right now, or, So I think I have, in most cases. Yeah.
With the DSM-5 and looking at it now, after the diagnosis, I mean, would you say you still fit into
Oh, I definitely fit into them all.
some of those boxes?
I fit into them all, really. But we talked about the subjectivity. Now realize when I go over a few of these, I'm looking at it through very different lenses than other people. Say, for instance, poor listening skills. I don't know very many people that have good listening skills. I think it's an art. I think people develop it. So is that really ADHD? They get sidetracked by external or unimportant stimuli. Well, I don't know. Do other people that are working on something get sidetracked? Lacks the ability to complete schoolwork and other assignments or to follow instructions. I've underlined the follow instructions because if someone tells me how to do something, or even if they should put a list of instructions in front of me, I don't do very well. But you show me once how to do something, I usually have it. So everyone learns differently in that regard, but it's part of the label. Avoids or disinclined to do homework or other activities that require concentration. Well, I would say there, again, being subjective, are they interested in it? Because I'd avoid it if I wasn't, right? And fails to focus on details or makes thoughtless mistakes. Well, some people are big picture people.
Yeah.
And some people are detailed people. And thank goodness for that, And then we've got the hyperactive symptoms. Appears to be driven by a motor or is often on the go. I mean, people would say to me, you've got like a ever-ready battery and, don't stop. But, I mean, we're so busy with kids and school and, I think a lot of people have that. I could be wrong. Lacks the ability to play and engage in leisure activities in a quiet manner. Well, what's a leisure activity? I mean, you sit anyone down without a book or a computer or their device, they're probably going to sit there and feel a bit edgy too. I don't know. My idea of a leisure activity is to get on my bike and ride 40 kilometers. It's not to sit down and do nothing. So, overly talkative? I think most people talk too much. Really. I think a lot of people like the sound of their own voice. But again, I'm wearing different lenses. And so kids are, because of these questionnaires, they're lumped into one of two or combined category.
Right. And then they get that label. Now
And then they get the label.
yeah, you've certainly achieved a lot despite your label or your diagnosis.
Right. Well, I never accepted the label as being
Yeah.
anything detrimental. I just thought, oh, okay, fine, what now? Right?
But with this potential overdiagnosis, based on, these subjective assessments that, we're all sort of checking those boxes, do you see some consequences, especially with our children?
Well, I do. And with adults and the overprescription of medication. I'm really concerned about that. Not only the labels, because I really believe once they're given, they stick. And I think that's really can be very harmful for kids. But the side effects and risk factors involved in the psychostimulants. I was reading a study, it just came out in JAMA Psychiatry in 2024, and they followed, it was 1,000, I believe, 300,000, people between age 6 and 64 who were on ADHD medications. And what they found, that the longer was cumulative, which makes sense, and every year the risk factor for hypertension and arterial disease went up by 4% every year in every age group.
Wow, even in the children.
Yes. And at year 5, it was 23% risk. And these risks were statistically significant. And they happened to round off between year 3 and 5 at about 27%.
Wow.
So I think this really reaffirms that we need to really be thinking about the choices we make before we give a medication. I'm not saying we never should, but with these added risks, never mind the use and misuse because of the increase in dopamine in the brain and because people get addicted to it and they overuse it, but the risk of cardiovascular disease is not being monitored, and it's highly recommended that the cardiovascular side of things be monitored
Right.
in these people of all ages. And from what I've seen, it's not.
And that's a side effect that's life-threatening. I mean, that's a serious
It's a serious
situation.
side effect. Yeah. And so is misuse
Yeah.
and overabuse, right?
Are the medications working for some, though?
Not very well.
Okay.
It's quite disappointing. I think they have a low but insignificant benefit, and they carry a high risk of suicide. I think it was about 64% risk of suicide-related events.
Okay. Are we seeing that in children and adults?
It was the children I was looking at.
Okay. Okay.
Yeah. I don't know about adults. I think this is newer. So many adults being prescribed psychostimulants because adults, previously, you would rarely see an adult diagnosed with ADHD, right? It was commonly diagnosed in childhood. But then 2024, 2025, it seems that the diagnoses for adult ADHD has gone up
Through the roof.
exponentially. And with that, the prescription rates for psychostimulants, mainly methylphenidates and amphetamines, which come with misuse and abuse. And adults, when they do want to quit, are having a difficult time because they go through terrible withdrawal.
It's very difficult to watch. And as NDs, naturopathic doctors, as in BC, we have pharmaceutical rights to prescribe. But I think it comes down to some of our naturopathic principles, right? First, do no harm and always treat the cause. So can you elaborate on some of the factors or causes that we might want to identify first before we jump into the medication side?
I can, and I think, again, I'm going to say, I think if we can just educate before we medicate, that would be a really good first step. And if you don't mind, because so many of these are important, I may refer to my notes because there's so many tips that I want parents and caregivers and those with ADHD to know, and I don't want to forget.
Yes, for sure.
So epigenetics, which we've covered, can affect the cell and tissues throughout the body and brain. Food additives, we've covered that. Red dye, number 4 particularly, they're finding is a problem in people with learning disorders and ADHD. Nutrient deficiencies, like we mentioned, magnesium, omega-3 fatty acids, not only for ADHD, but for most mental health disorders, especially in kids and young people who have such a higher need for these nutrients: magnesium, folate, B vitamins, pesticides and environmental toxins, which I mentioned, neurotoxins affecting the brain and the structure, gluten intolerance, getting back to the gut brain, and how that affects mental health. Sugar, some studies have attributed sugar particularly to ADHD. Electromagnetics, electromagnetic radiation, this big soup that we're swimming in, and then all the devices, we're already kind of what I call a robot, like I have to laugh at myself. I've got my computer, I've got my phone, and I'm watching something on TV, and I'm going, wait a minute, So there's the electromagnetic, and the National Institutes of Health just came out and said that the disturbances of the area of the brain responsible for learning and memory are alternated from the exposure to electromagnetic frequencies. So allergies are extremely important as well in children with learning disorders, as well as kids with ADHD.
Okay. So identifying those allergies, what they are, and
It's really important. And I think based on that, if people wanted to learn more, there's more in the book, but also the work of Doris Rapp is valuable information on where I learned so much on the effects of allergies and behavior and learning problems.
Okay, so you did mention nutritional supplementation. Can you elaborate a little bit more on some vitamins or minerals that would be helpful?
Well, I think omega-3s are incredibly important, not only for people with ADHD, but other learning problems or mental health disorders. It's been proven effective for people with depression and anxiety. So omega-3s are simple to add into smoothies and, great brain food, as my grandkids would say. So omega-3s, absolutely. Omega-3s, I mentioned that. A multivitamin. They have shown that healthy children between the age of 8 and 14 that were given a daily multi had increased accuracy in all attention-based tasks in school. A multivitamin.
Right, something so simple.
Yeah, so simple. And the one mineral deficiency I really want to talk about, especially for ADHD, is iron. Young children and teens in their developing years have a greater need for iron, and most are deficient, and it's a common cause of ADHD. And if I could add here, if parents suspect that and they go to have iron status checked through lab, I would encourage their doctor to not only check for hemoglobin, red, the iron, but also ferritin, which is a much better assessment for iron status in the blood. And I think that's really, really important for what we're seeing with ADHD kids and iron deficiency, and in vegetarians particularly. So protein, we've talked about that. They found that kids with ADHD who ate protein in the morning or at lunch did equally well, if not better than, kids without ADHD in tasks throughout the day. So protein, mixing it with our liquid omegas, my grandkids' brain juice, and other nutrients that these kids could take in the morning would provide huge benefits. And then for parents and caregivers, clear, established routines. Because people with ADHD have a hard time setting that up for themselves. Time management for these kids are difficult, so I think that's something that both teachers and parents could be aware of. to help them manage their time better. Like I've seen, say with one of my grandkids, he's a November baby. So one of the ones that we would be more easily diagnosed because he's a year younger than everybody else in his class. Oh yeah, I can do that tomorrow. I can do that tomorrow, Grandma. And then tomorrow comes and he's scrambling or doesn't get the project done. So, time management, making sure that they start early, minimize distractions in the workspace. Don't allow the TV on, don't allow music playing, kids running in and out if you can allow fewer distractions. And break things up into smaller tasks. It can be totally overwhelming with most people, but I think particularly people with ADHD if they're just given a big list of tasks. Whereas if you can say, hey, can you do this one? Tick. Do the next one. And then provide encouragement even for the small accomplishments, because I think kids with ADHD are used to getting more negative feedback than they are positive. Right. So when they can learn to make the changes, I think they need the kudos. I mean, we all do, but they do in particular. Yeah. So educate family members, educate teachers, educate the people themselves, and let them know that they can succeed and thrive. That if they have been given a diagnosis of ADHD, it doesn't mean that they can't succeed. I think if we read a lot of the information out there, we think that people with ADHD are incapable of nothing. That's so not true. I mean, some of the most intelligent and successful people I know have ADHD.
Like yourself.
Yeah, but they're worse than me. I can hardly follow them sometimes, and that says something. But there's ways of working with it, as long as we have the empathy and the understanding. And I think that's probably the most important thing, is to have parents take the time, learn where their child is struggling, and then do whatever you can to help support those areas. And when it's necessary, seek the help of a counselor or someone that does cognitive behavioral therapy. CBT has shown to be very effective for people with ADHD. And if you still have concerns, then perhaps a medication would need to come into play. But really be aware of the risks. And I would say try other things first.
Yeah. And together, I think holistically, these things that you've mentioned really can be powerful.
Exactly.
And as parents, we have the responsibility and the privilege, right, to understand and educate ourselves for our children. Yeah. And helping with that label if it does come, because for some that can provide, self-realization, and for others it can be really damaging.
It can. And even for the parent, which I was shocked. I talked about the stigma back in the day. That stigma is still alive and well today. I was talking to a close friend of mine whose grandson has ADHD, and little did she know that his friend did. But the mother of that friend will not talk about it because she's embarrassed, because her son is less than perfect. He has a diagnosis of ADHD. Well, so what? I mean, we're all different, and we just need to educate what it's all about and to help where we can. And there's so many things we can do, and as you say, the responsibility and the privilege as a parent, it's a gift and it's a huge responsibility.
Thank you so much, Karen. Thank you for being here.
Thanks,
Jen. I can see the empathy in your eyes, having lived with ADHD for decades, so I really appreciate your time.
Thank you. There's so much more out there for people today, unlike when I was growing up, and I think all these kids can thrive really well.
Thank you.
As a naturopathic doctor who's lived with ADHD my entire life, I know that it's possible for children and teens to reach their goals. There's so much more awareness today, and therefore much more opportunity for parents, caregivers, teachers to understand some of the challenges, and also to provide environments that are more conducive for those with ADHD to learn and to thrive. I've provided some great tips in my new book, Mental Health Crisis in Children and Teens.